So we have Debbie from Buffalo, New York. I love these questions from
great,
all
aren't
over
they?
the United States. So Debbie has a 4-year-old chocolate lab. About 3 months ago, she noticed a lump on her dog, and the vet said it's nothing to worry about. It looks like he drew some fluid from it. It was negative, and he told her to just kind of leave it alone. Another similar lump appeared, and while they don't seem to be bothering the dog, she just kind of wants to know, well, why are we getting those? And can you offer just any more information or insight?
Absolutely. So this is a really, really good question because lumps and bumps can be innocuous in our dogs, but can be very, very dangerous also. So what Debbie is alluding to is what the veterinarian did is called an FNA or Fine Needle Aspirate. And that is, if we see a lump that we're concerned about, we can actually block that area a little bit, shave it, clean it, and draw some cells. It wasn't really just fluid that he was drawing. Draw some cells from that area and look under a microscope, or even send it to the diagnostic lab if there's questionable cells there or a question in our mind when we look at it in office. The lump that she was probably referring to on that fine needle aspirate.
Can I guess?
Yes, please.
Was it a lipoma?
Oh, very good. She's so smart. This girl
You're giving me too much credit.
This girl is going to do so well. So a lipoma is a benign fatty tumor. So I want to mention one thing. People always say, well, it's not cancer because they think it's benign. So let me explain that cancer is an abnormal growth of normal cells.
Yes.
Benign or malignant. So they're always a cancer, but they're not necessarily a bad cancer or a malignant cancer, which is the one we worry about.
I just learned this in class, and we were talking about using the word cancer properly, but that can obviously cause a lot of fear because we use that word incorrectly all the time.
Absolutely.
And so I'm glad that you touched on that. That's so exciting.
Yeah. So basically, the cells were withdrawn. They were looked under the microscope. They were fatty in nature. There were no abnormal other cells there. And the veterinarian determined at that point that this is a lipoma. And he or she was absolutely right. Most of the time, we leave those alone. Now, the two places that I worry about the most on lipomas is one when they get underneath the front arms in what's called the axilla, or also in between the back legs in what we call the inguinal area, because they cause pressure on the leg and they can really be uncomfortable. And we've seen them as large sometimes as basketballs. They can get that big.
Yeah, my dog's had a couple, and unfortunately he has one kind of in that unfortunate area right now. So
it's usually a place where I usually recommend considering surgery because of its location, not because I'm worried about it being what we call a malignancy. So in the lipoma situation in labs, because it's not uncommon to see that in labs and golden retrievers, some of it is weight related. So some dogs that are gaining too much weight or growing, gaining too much weight quickly will form these more and more often. There's definitely some genetic disposition to getting them, but I tell people again, we're looking at getting those inflammatory carbs out of the dog's diet if we can, feeding them consistently where they're not, gaining weight. We body score them in our practices 1 through 9. We like to see them around a 5. When a lab starts getting into a 6, 6.5, or 7, I get worried because that's when we can see these coming up. So that's actually the best preventative you can do for lipomas.
which makes sense because if it's essentially a cancer or just an overgrowth of fat cells, you would expect that's because we're maybe eating too much. Gaining too much weight, gaining too much fat, right?
Absolutely.
So
Absolutely.
It makes sense.
And we've talked about the dog longevity study that showed that dogs that are fed on what we call a calorie restricted diet, which means they're getting what they need but not over what they need, tend to live about 2.5 years longer besides. So there's really good reason to look at making sure that we don't let our dogs get overweight, especially our labs and our Goldens who are prone to these lipomas.
I would say that's most of the dogs that I've seen the lipomas on.
Exactly.
Well, thank you, Debbie, so much for your question. We love getting your guys' questions. If you guys have any more, please feel free to add them onto the Instagram, the YouTube channel, or even the website, which are all at Dr. Randy Pet Vet. And thank you guys so much.
Yep. And you can reach Olivia also at Dr. Saatchi, right?
Perfect. Well, at Dr. Saatchi on Instagram. Yeah. SACCI for my last name. It's
perfect.
Kind of like Versace, Italian.
Perfect. I love that. So cute. Well, thanks for joining us. We'll bring you another question coming up down the road and talk to you soon.